In Saskatchewan, there's two major opinions on BC's decision to recriminalize drug use in public places. The first, in this case coming from the Saskatchewan government, unsurprised it didn't work out.
If you decriminalize these hard drugs and you don't have a treatment model as part of the model, and part of, in this case, the pilot project with the federal government, you have a problem.
The other side comes from advocates for harm reduction measures. They say the BC provincial government and the feds are stepping away too soon, that decriminalization is a part of the solution along with treatment and housing.
The reality is that people are incarcerated every day because of their drug addictions, and it's costing our taxpayers millions of dollars a year to keep them incarcerated. So, it's even though they're saying it's a health issue, we're treating it as a criminal issue.
In BC, Vancouver's deputy police chief testified to the House of Commons Health Committee that it was limiting police response. BC Premier David Eby's political opponents are also critical of the policy and the fallout, including disputed allegations of drug dealing in hospitals.
People are continuing to use drugs, illicit drugs, inside the hospital, placing other people at risk.
In Saskatchewan, the strategy since January has been to expand addiction spaces following a recovery-oriented system of care. It includes detox along with pre- and post-treatment for users. A longtime addictions counselor helped prepare for it.
Helping people move into recovery is important, and harm reduction is a really valuable piece of that. But that doesn't mean that you just give people, whatever they think they want.
Regina police say they prioritize arresting dealers and traffickers over users. In Saskatoon, decriminalization was discussed 2 years ago, but the city wanted to wait for the results of BC's pilot. It also considered a research report that concluded decriminalization would benefit society.
As much as people will sometimes argue that harm reduction allows people to do drugs, criminalization doesn't prevent people from using drugs. It simply increases the harm likelihood.
Fornsler says decriminalization is valuable, but it needs to be paired with things like housing, treatments, and supports to work well. Yet the government of Saskatchewan is steadfast, insisting you will not see the same type of drug decriminalization here. Dane Patterson, CBC News, Saskatoon.